This is a vulvar puppet.
Oh, that's
I'm
funny.
not kidding. It's a
No,
vulvar
I see.
puppet.
I see it. I see it.
You see it?
Thank you so much for joining us today on Second Act TV. I am so excited to welcome back Dr. James Simon, board certified OBGYN, clinical professor at George Washington University, and the founder of IntimMedicine Specialists. Thank you so much for being here again, Dr. Simon.
My pleasure. It's good to be with you.
Well, your CV is so long. We can spend all segment really just talking about your accreditations and accomplishments. What I do want to point out, though, for our audience, right up front, are two notable achievements that you have, and that is you are past president of the North American Menopause Society, and you're past president of the let me get this right, the International Society for the Study of Women's Sexual Health. And well, today's topic, the care of the aging vagina. That is one of the topics you recommended that you see again over and over and over again, that women don't know their vaginas. And I can attest to that. I never knew about thinning of vaginal walls, painful sex. And I want to share that for our viewers listening, that you're so normal if you fall into that too. And obviously you know that better than anybody because you see all these women.
Yeah, so it usually sneaks up on women. Remember, when women are sexually aroused, they make lots of their own lubrication. But once it starts to get drier, thinner, and less elastic, then pain becomes not just mild, but can be actually excruciating. And most practitioners of medicine who are not that age or do not have very much experience, they tend to minimize the pain associated. So let me jump back just a little and talk about normal anatomy.
Okay.
And if I might, I actually have a visual aid. You tell me if it works, Silke, okay?
Okay. Okay.
This is a vulvar puppet.
Oh, that's
I'm
funny.
not kidding. It's a
No,
vulvar
I see.
puppet.
I see it. I see it.
You see it?
Yes, I do.
Now, we tend to talk about everything down there as the vagina, but it's not. So let's get our terms correct, because understanding the terms helps us better understand the process and the treatment. So this is not a vagina. This out here and over here is the vulva. And it naturally has hair on it, unless it's taken off, which is the style these days, to have it removed. Okay. And that hair gets thinner and grays, just like the hair that we have elsewhere. Just saying, keep it in the back of your mind. That's the vulva. And then we have the small lips, which are also considered part of the vulva. And then we have the inside part, or the barrel of the vagina. And you'll see on this little model, it's a completely different color because it's a completely different tissue. The vulva is skin, just like the skin on your face has hair or it doesn't because we've taken it off. The barrel of the vagina is a different tissue. And then, interestingly and importantly for our conversation here, between the vulva and the lips and the barrel of the vagina is a small 1 centimeter or finger's width of a different tissue called the vestibule. It's the vestibule where most women have the pain of penetration. Now, this is going to sound like I'm getting in the weeds, but listen to me here. So the barrel of the vagina, which can stretch to accommodate a baby's head without tearing, is derived from the same tissue as muscles and bone. This is really, really tough stuff, muscles and bone. And that's why the barrel can stretch and not tear. The vulva is derived from the same tissue as skin elsewhere, but also hair and nails, fingernails. It's tough. Same tissue. And by the way, skin does not stretch. The vestibule, that little rim of tissue around the opening of the vagina, where women experience penetrative pain, is derived from the same tissue as the inside of the bladder, the urethra, the inside of the intestines. This is very sensitive tissue, not really meant to be exposed to the outside world, but it is. And it needs careful attention and treatment after menopause because it's dependent upon reproductive hormones for its strength, for the thickness of it overlying the pain nerves that are there. If it's thin over those nerves, there's more pain. I'll give you an example. And it's also, interestingly, dependent on testosterone as well as estrogen. So it has these unique characteristics that make it extremely painful when not supported by hormones. After menopause, women lose their hormones. And so they have more pain, less ability to stretch that area, and sex goes by the wayside. Even touching.
That's probably one of the best explanations I've ever heard about I just learned stuff, and I know our viewers have. I really want to hear comments on this. We get tons of comments on these videos, and I bet our men, lots of men, if they'll admit it, have learned so much just now that I really thank you for that. They need to rewind it and listen to that again. So now that we know the vestibule and that's where the issue is, I'll throw it back over to you.
What we usually do, because historically it was the norm, is we would put estrogen or an estrogen-like substance in the vagina to affect that barrel that I talked about, to make it thicker, to give it more pleats. You know, all the women listening, they know that elastic in your skirt that's a little too tight is a good thing. And without pleats, it's not going to work out very well for you on a good dinner or at Thanksgiving. The answer is you want lots of pleats in your barrel of your vagina so it'll stretch and not tear and not be painful. But if there is resistant or residual penetrative pain, might need attention to the vestibule. And the skin needs a good moisturizer, just like we put on our faces at night, or, you know, if we're going to go out in the sun, we put a moisturizer on with sunscreen in it. The answer is got to take care of the nibbly bits, as they say, in the same way, and yet we ignore them. We ignore them because they're going to take care of themselves as they had for decades between age, let's say, 15 and 45 or 50.
Well, I want to point out one other thing that I learned just early on in this show is that the difference between lubricants and moisturizers. I didn't even know the difference. So again, there's so much that women don't understand, and certainly that men don't understand. It's not because you're stupid or dumb or uneducated. It's because we don't talk about it, and that's why we have these conversations. So hopefully we can get past painful sex, which is a large part of today's conversation. So Dr. Simon, what you mentioned a few, the testosterone, the estrogen, the internal meds. What are some options out there that if somebody's listening, oh my God, that's what we're dealing with, what do I do?
So historically, we've used estrogen creams in the vagina. And because creams at room temperature become more liquid at body temperature, they tended to leak out and coat the vestibule. That was a good thing. But then they tended to leak out and make a mess, which was a disincentive for women to keep using them. Two things happened. The amount of cream needed evolved and was used with less volume, so there was less mess. And sometimes less mess meant not even enough to get onto the vestibule, so it appeared not to work.
Not to work.
So there's this delicate balance between enough of one in terms of its treatment and enough of one in terms of its volume. Then we developed much more user-friendly ways of getting estrogen into the vagina. Tablets, vaginal rings, suppositories, and other ways of getting it in there with less dripping, gooping, and mess. And that was great unless you needed something separate for the vestibule. And then let us not forget that women take the hair off their vulvas to be in the know or in the mood or be clean or look like their favorite porn star or for whatever reason. And they forget that they need to take care of that skin that was before protected by hair. Remember, hair is part of our protection mechanism. They need to take care of their vulvar skin, and whether that's moisturizer or some other way of caring for that skin, they need to take care of that skin too. You mentioned lubricants versus moisturizers. Let's just do a little superficial dive there. Moisturizers of the vagina do what moisturizers of your face do. They keep the tissue moist. That's all they do. They're used unrelated to sexual activity. You put moisturizer on your skin at night, you put moisturizer in your vagina at night or once a week or twice a week, whatever's necessary. Lubricants are used for sexual activity because we humans dry out as we age. Everything gets drier. A lubricant is just adding slipperiness at the time of sexual activity. And there are 4 basic groups of lubricants by type. There are water-based lubricants. Your doctor uses a water-based lubricant when they're doing a vaginal or a rectal exam. They are the most easy to wash off because they're water-based, but they are also the easiest to dry out because they are water-based. And older men and women having sex, everything takes longer than it did before, and not infrequently, water-based lubricants dry out and they need to be reapplied because they get sticky when they dry out, which is even worse than not using them. So they need to be reapplied or rehydrated. Then we have silicone-based lubricants. They never dry out, but they're much more difficult to wash off. And for older men and women that take a shower after they have sex or a bath after they have sex, those silicone-based lubricants can coat the floor of the shower or the floor of the bathtub, making it lubricated so that the next time they get in or when their partner gets in after them, they can slip and fall because they've just put slippery lubricant on the bottom of the shower. That's a problem. Need to warn your partner or remember to clean the bottom of the shower after silicone-based lubricants because they stay slippery, which is the purpose. Then we have oil-based lubricants. Oil-based lubricants are a mixed bag. Some people like them, some people don't, but they are oil-based lubricants. The old-fashioned paradigm was Crisco. Crisco is just cooking oil, but the answer is it's an oil-based lubricant, and people used to use it for sex all the time. And then the 4th category is some combination of the other 2 or 3 categories. The problem with hybrid lubricants is that if you mix an oil-based lubricant and a water-based lubricant, kind of like Italian dressing, it needs to be mixed up because it settles out. And in order to get a uniform hybrid, you got to mix them before you use them. Enough on lubricants.
Where do you get this? Yeah, our viewers again, I see the comments here. Where do you get this information? Where do you get this information? Thank you, Dr. Simon. Please go on.
I don't know. It's there somewhere, but the answer is that's what you need. And in terms of lubricant use, really important, have that discussion before you're in bed about lubricant. Is it necessary? Is it unnecessary? And who's going to do what to whom with the lubricant? Now, many women don't want to admit that they need it.
Yes.
You know, they're sloppy wet from the first kiss, not so much. But the answer is lubricant. So who's going to use it, how it's going to get on, and how it's going to get on whom? And the answer is it needs to go on both partners. And it can go on both partners in the most loving, caressing, stimulating way, but it needs to be on both partners because both of you need to be slippery. And then there's a problem with being too slippery because everybody needs a little friction to get stimulation. And if you use too much lubricant, there's no friction. So there's no stimulation. So it was a bit of a delicate balance.
I tell you, I was teasing you a minute ago, but seriously, where else do you get this information than right here, conversations like with you? I mean, there's so many things. Again, I'm just going, oh, wow, what a way to explain it. These are all questions that we are afraid to ask. We would never think about, you know, oh, my lubricant is going to make me slip and fall in the shower. I mean, I'm laughing about it, but it's true. And who tells you that? Who tells you that? We are so lucky to have you here today, Dr. Simon.
Thank you very much. I'm happy to be here, but there's lots to learn.
Right.
There's lots to learn. And the fact that we're all learning together as we age is the rule. Take joy in learning about yourself and about your partner. You really want the same thing, but we've never been there before.
Yeah, this is it's really an entertaining instructional video. I think that, you know, if anybody, any of you listening out there, if this resonates, or you're thinking, oh God, I wish she would know that, I wish he would know that, you know, this is something to forward on because there's stuff right here that I hate to admit it, but I learned something again today. So I won't tell you which one. Well, having said that,
I hope everybody learned something. I have a goal in my personal life to learn one new thing every day.
Yep.
And it doesn't matter if it's in my biological life, in my personal life, in my professional life. I want to learn one thing new every day.
Yeah, that's great advice in and of itself. Of course, we're coming to the end. I could talk to you forever on this topic, and as well, there's so many different ways to take this, and I hope you'll come back again soon. I do want to ask you, is there anything else that you want to add here that I didn't ask, that we didn't get to? You want to make sure we get it in?
Just be open about what your needs are in the bedroom and ask. Nobody can know but you. Don't demand, use what I call I language. So for example, you could tell your partner that you'd like something softer, saying, I like what you're doing, but I like it softer. You could say the same information in a blaming way by saying, you're doing it too hard. And that's going to set up a barrier, a discord, and you're not going to get what you want anyway. So
Right.
Use I language, start out with the letter I in everything you say related to the bedroom. I like this, I like that, I wish I this, I, be it self-directed. Communicate in that way. You won't be blaming. He or she, your partner, will get the information, and everybody ends up in a better place.
Yeah, absolutely. And and be open about, admit to painful sex. There are so many women that don't, and you don't have to suffer with it. You don't have to cringe. So hopefully a lot of you have learned along with us, or maybe me, that you just need to know about, and we can enjoy sex as we get older and older and older. So Dr. Simon, again, thank you so much. I will link to all of your information to your website. Dr. Simon does do telemedicine calls. If you're interested, obviously he's wonderful to talk with, so open, you can ask anything you want. And I hope to see you again soon, Dr. Simon, on Second Act TV.
Thank you.